Will I need fillers? Skin sagging at 22. My under eyes and the sides of my mouth seem to sag. I did lose 15 pounds a month ago. I went from 145 to 130 after getting sick and have gone to 133 recently. But it seems as if my face is always sad and downwards. I am only 22 and I feel very old looking. Especially my under eyes and my parentheses lines are very deep and hang low as well. My side cheeks seem to somewhat drop down near my mouth.
Thank you for your question. You submitted your question with several photos, and you state in your question, you're asking, will you need fillers? And you're concerned about the appearance of your under eye and other areas of your face after undergoing some weight loss approximately one month prior, the amount of about 15 pounds, where you went from 145 to 130, and that you state that you are now at 133, and that you are 22 years old. Well, I can certainly share with you how I've advised people like yourself, your age group, who have come to my practice with similar concerns after an illness, even though I don't know the details of the type of illness you had. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people improve their appearance for what you're describing is more of a typical age-related change, is something that has been the center of my practice, whether it's surgical or non-surgical solutions. So to begin with, I think it's very important to understand the distinction on when someone needs fillers versus when someone doesn't. And when we talk about using fillers, if we're talking about someone, let's say over the age of 35 or 40, we're talking about facial aging changes, which is associated with a certain amount of bone loss, fat loss, and soft tissue loss, and loss of the integrity of the skin, part of normal aging. When we talk about using fillers in someone who's younger, well, usually that's something that's more of a genetic issue. So for someone who has, let's say, less prominent cheekbones, someone who has naturally very thin lips, we sometimes distinguish, when we're dealing with someone with facial aging changes, we refer to that as correction or restoring. And when we talk about a younger person who has, let's say, a genetic structural issue, then we refer to that as beautification. Now, that being said, in a situation like yours, where if you had a stress on your body that you are recovering from, I would say that it is best to allow at least about a year to normalize. This is a time of your life where this is the bloom, and this is when your body is very resilient and is in the blossoming stage of what everyone describes as youthful life. And so this is your young 20s, and what I've observed is once health is stable, then everything comes back to its place. This is something that, depending again on whatever illness you were dealing with that led to this significant rapid weight loss, that can have a short-term impact versus a long-term impact. But I would say that after a year, you can certainly reevaluate and decide whether or not there may be some value in doing something for the under eye area. Typically, for an under eye area, we do something like a filler in the tear trough using Restylane or a hyaluronic acid filler. Or for someone with facial aging, we'll do something like structural volumizing, where we put volume in the areas where there's bone loss, where there is an opportunity to restore what has been lost. So again, it brings us back to the original point. If your illness was something where there was a temporary loss of weight, well, it's most likely proportionally more about soft tissue or fat loss. But the bone structure, of course, is still intact, which means that as you gain your weight back, then chances are everything will also come back to its normal track. So I'd say again, allow yourself about a year from the time that you recovered from your illness to see how you'll look, and most likely if you basically follow some golden simple rules of eating a good healthy diet, sleeping enough, and exercising and avoiding toxic influences such as smoking, then more than likely you will be back to your youthful appearance without the need for any type of aesthetic interventions. So I hope that was helpful. I wish you the best of luck. Thank you for your question.